Welcome back to KMI Community Connect. Today's discussion is Metabolism Made Easy Part 12. We had a little bit of gap between Part 11 and Part 12 because of the summertime, but I would like to delve directly into the discussion where we left last time. We have talked about a little bit about osmolality, a term that probably some of you are not aware, and I am going to go more elaborately deep and explain that today with some conceptual thinking and demonstration. But before that, we brought in the concept of sodium that is related to high insulin in our last discussion. More and more insulin, which is the quantity, more means quantity, higher and higher quantity of insulin from higher and higher quantity of glucose led to high sodium retention. I have very loosely mentioned that sodium gets retained with high insulin because of the quantity, and it retains and thereby draws more blood from the kidney. Sodium retention from the kidney, water retention from the kidney, thereby leading to high blood pressure. So we connected the high blood pressure to glucose through insulin, and now from there we also went to adding that sodium here and adding that glucose here, and we also brought in the concept of blood urea nitrogen, uric acid, which comes from fructose, not glucose, that also adds to everything called osmolality. Now, osmolality, I will explain today more in detail about that, but the number that you have to remember, what is the number for osmolality normal for in the blood is 275 to 295 milliosmoles per kilogram. Don't worry about all this. Usually most of you have probably never had this checked in the routine blood test. This is not a routine blood test. This is done in intensive care units and some special situations. But you must have seen the sodium number here, which is 135 to 145 when you check your blood test, milliequivalents per deciliter. So I brought in the sodium number and I brought in the glucose number, which you know that it is about anywhere between 70 to 100, and we put a formula, and from there that's where we brought in that concept of osmolality where we left last time. Now I am having said that, with increasing quantity, what we talked about, the quantity of insulin all the time, the number, I wanted to slowly tie this up, because now we actually brought in all the sodium, glucose, uric acid, fructose, and fat and blood pressure, everything together. Now I also wanted to talk to you about untying it now a little bit, one at a time. That way you will understand once I untie again and go into the specifics of each of those for you to understand better. So now we thought that what is the common link between glucose, high blood pressure, fat making, and all the stuff. So today I will put in the center here the most important. I'll connect this to, I'll put sodium, which is called Na, and that is nothing but, this is the ion, sodium ion, that determines the blood pressure, and I will put high blood pressure, which is hypertension that we're talking about. Now, so we are actually tying the, instead of tying what we did last time when we tied the loose ends and brought in all together, I am loosening it up again and going back to each one separately, and today we'll mostly discuss about sodium in our discussion, because that's the main contributor, as you all know. So sodium with regards to high blood pressure, so today we are mostly talking about its role and how it is related to the osmolality. So the traditional thinking and the going knowledge that has been traditionally taught for everybody is sodium is connected to high blood pressure. Most of you know, a lot of you know, and then that sodium is connected to kidneys. the kidneys, two kidneys that we have. Sorry, that's not the best diagram, but so the sodium, if the kidneys are not, this is the bladder going out, if the usually we all know that if there's a problem with sodium, there's a problem with high blood pressure, and that is related to the kidneys. So if kidneys do not excrete salt, which is sodium, then that salt gets retained back. It gets retained back into the blood, and that's retained sodium will cause increased blood pressure. So because more sodium is retained, water comes along with it and the volume increases, and if this is the blood vessel, then there is more volume going into it and the blood pressure goes up, it increases, and the blood pressure goes up because of more volume. So you could say that this is a blood vessel, just for understanding. Now, so having said that, with high sodium, and that's the conventional thinking, so it's the inability of the kidneys to excrete the sodium, and there's more retention of the sodium, more blood volume. This is what we knew, and this is what has been taught for many, many years. But we always, so if you want to treat high blood pressure, we have always been told to decrease the sodium. So it's mostly we are talking about the quantity, the amount of sodium, to decrease the sodium. And if you want to treat blood pressure, or if you want to have low blood pressure, not eat salt or decrease the sodium. While we already talked about insulin causing sodium retention, if you recall, I just talked about that. So it is about always the quantity that we've been talking, but increasing knowledge about this in the present day with more emerging science and more research, we have understood more and more about it is not about the quantity like decreasing the salt. It is about something called osmolality. I will explain that because it's the concentration, which means osmolality. Osmolality is translating to concentration. So why did I bring this concept? It's not about decreasing the amount of salt. It is not about telling them to eat less salt. It is about the concentration, which is actually more important that we have to talk. So for you to understand that, because I will explain this whole phenomena one more time, I will give a small demo for you and you will understand exactly what I am saying. So in here, I have wanted to tell you, so what is osmolality? Osmolality is a set number of molecules in a set volume, in a fixed volume, that actually will decide the concentration, and that concentration is reflected in terms of blood pressure. How much concentration is there? If it is very concentrated, blood pressure goes up. If it is very dilute, blood pressure comes down. If you put, so for instance, I'll explain to you what is that concentration and osmolality mean, because the osmolality translates into concentration and that concentration translates into blood pressure. So this is sugar, and I am taking, this is about, let's say, 8 ounces or 10 ounces. These are different sizes of volume, the liquid. Now imagine that this is blood, for instance, and if I am putting 5 grams of sugar in that, in a set volume, versus 5 grams of sugar in a lesser volume, versus 5 grams of sugar in a much lesser volume, you can see that that is even smaller, and same 5 grams, same concentration, same amount. So it's not about the amount, it is about the volume and the concentration that we are talking about. So same amount of sugar, it's not about the amount, that's why I'm putting the same amount to show you what happens. So now of all these things, there's more volume here, little bit less volume here, little bit less volume here, little bit less volume here, but I put the same amount of salt. So it's not about the amount of salt, but it's about the concentration. Now if you can guess, obviously if the same amount is there in lesser volume, this is more concentrated. this is more, this is less concentrated, this is even less concentrated, this is even much less concentrated. So the pressure here, the sodium, if I put salt now, for instance, if I put salt just like sugar, I put the same amount here, I put the same amount here, I put the same amount here, and I put the same amount here. Now the concentration in this is more. So if you imagine this like the blood, and if somebody has more concentration in the same amount of volume, in lesser volume it's more concentrated, in more volume it is dilute. So it is the dilution that matters. For instance, if we imagine, for this example, I'll give another demo. I want to give soup because I want to give a salty soup to somebody, and let's say I am putting 8 or 10 ml, whatever is this thing, and then much less than that, only 4 or 5 ml water. This is the blood. Let's say you have less blood, and this is this. Let's say this is soup, first of all, from outside. This is not inside the body. So if I give a salty soup, so I'm making a salty soup where this is the soup that I want to give, and there is less soup with lot of salt. Now if I give this salty soup to somebody, their blood pressure can go up. Let's say if their blood pressure is 120, and then by giving that much, this can probably go up roughly, let's say 128. Now how does it translate to in terms of sodium? Your sodium will probably grow from 138 to 141 or something like that. See, we have a 135, so that much, 2 to 3 points will increase probably the blood pressure. This is somewhere rough numbers, 7 or 8 points transiently, and then it comes down. So that much of sodium is causing the transient increase in the blood pressure, and then it comes down in 2-3 hours. This is what happens because of the pressure of the molecules, the concentration and osmolality. Now, but if I just give the same thing, the salty soup, but I add a lot of water and make it dilute, make it very dilute, and they drink more water along with it, the blood pressure will not go up. The blood pressure will probably stay 120, 121, and it will not go up. So the point that I am trying to make here is, it is not about the quantity, it is about the concentration. For instance, so the salty soup that the one person gets with lot of concentration, less dilution, he will have more higher blood pressure, as opposed to somebody who drinks it with lots of water and it is diluted for the same amount of salt, he will have no change in the blood pressure. So this is the concept. So how does this happen? This is about the concept of understanding the osmolality, like I told you. And in the blood, it's not just the salt, it is the glucose, it is the blood urea nitrogen that comes from fructose and uric acid, and it's also, today we talk mostly about the sodium that determines the blood pressure, because there are many other reasons why your blood pressure can go up with high insulin, sodium retention. We are going to talk more and more about this blood pressure details and mechanisms and other causes, including uric acid, fructose. We talked a little bit about how glucose causes insulin elevation, and in insulin elevation retains salt. So we are trying to untie and talk one thing at a time. Today we spoke about the sodium part of it. We are going to come back and talk more and more about the causes, what happens in the blood pressure when the blood, how the insulin causes the high blood pressure in the blood vessel, how sodium, we talked a little bit about how sodium caused high blood pressure with the concentration more than the amount, and we're going to go more in details into uric acid and fructose and how that affects various mechanistically, how it affects the blood vessels and causes blood pressure. Of course, there are many more other reasons how blood pressure goes up: external threat, sleep apnea, when there is a trauma, stress to the body, but we are mostly focusing on these aspects. So I will come back and talk to you more in my next part, more in detail about the blood pressure and I hope you understood a little bit about mechanistically why I mentioned about osmolality sodium that determines the pressure, number of molecules in pressure, and how concentration makes a difference. It is not about the amount and decreasing, it is about diluting and what is the state of your body, how hydrated you are. So I will be bringing the concept of dehydration and hydration, because when you are dehydrated your sodium goes up, when you are hydrated your sodium comes down. So it is not the quantity, it is the concentration that matters. That is the point that I was trying to drive today. I hope I made it very clear, but we'll untie this and bring back more and more of these details later in my next presentation. Thank you so much for your time.